I am now pleased to introduce our student speaker, Sumantra Monty Ghosh. Yeah. Monty, or more appropriately, Dr. Ghosh, is an MD on the faculty of both the University of Alberta and the University of Calgary in Canada. His clinical and academic focus has been on substance use disorders, harm reductions, and populations experiencing homelessness. Dr. Ghosh came to Harvard Chan for an MPH to further develop his research and policy skills. He was able to put those to immediate use, working to create safe and humane approaches to caring for individuals experiencing homelessness during the COVID-19 pandemic. His commitment to serving every human being with dignity and respect make Dr. Ghosh a true role model for all of us in public health. I'm delighted to welcome him to the podium for his remarks. Monty, take it away.
Thanks, everybody. Greetings, Dean Kim, faculty, staff, and distinguished guests. Class of 2022. On my way to our festivities, I took this quick COVID-19 test. I'm pretty sure I'm not alone in swabbing to protect our fellow classmates, friends, and families. Many of us badly want to bring some extra guests to today's ceremonies, but I can say with certainty that COVID is one guest we all definitely did not want to bring. Here in my hand, I'm holding a marvelous invention which allows us to celebrate together with a greater sense of safety and security. It's one of many innovations that we have seen during the pandemic, but it makes me wonder if it furthers the gap between the haves and the have-nots. At $20, it is likely affordable for most of us Harvard grads, but its price tag may be out of reach for many. For my patient Sandy, $20 would be the difference between a reasonable meal or rummaging through scraps. Sandy lives in a shelter struggling to meet his everyday needs. Today, if our COVID test is positive, we are able to isolate at home. But for Sandy, there is no home to isolate in. On any given night, Sandy sleeps on a mat next to 1,400 other individuals, many of whom are not masked. If he chooses to avoid COVID by staying outside, he deals with violence and crime, a risk to his personal safety. While outside, he also deals with the elements. When our shelter was in outbreak, Sandy chose to sleep outdoors during a cold snap. A week after, he came to show me his blackened toes, frostbit and numb. The look in Sandy's eyes told me he knew he would lose his toes, but seeing the gangrene creeping up to his ankles, I knew he would lose his feet. While the world responded to COVID with brilliant solutions at a breathtaking pace, it left Sandy behind, whereas inequity literally jeopardized life and limb. One of my favorite phrases is innovation for equity. Whether it be methodological innovations, new concepts, policies, or technology, innovation has brought greater equity to our world. Take the impact of smartphones around medical accessibility. With FaceTime, struggling individuals no longer need to take a half day off of work or a child sitter to make a specialist appointment. Smartwatches monitor our heart rate and our breathing, alerting us to dangers before we even feel symptoms. Mail-in kits allow those in rural communities to screen for colon cancer without driving long distances to reach a lab. Simply said, innovation can change everything. But while innovation has created equity, often it is unintentional. The motivation to create disruption was for profits, convenience, or growth against competition, but not necessarily to meet the needs of society's most vulnerable. We failed to innovate around the principles of social justice and economic equity. There are few innovations geared towards affordable housing and managing food insecurity. We have seen rapid innovation around work-from-home solutions, but for some, is home even safe? Where was the innovation to protect those who could not physically distance while working in factories and meatpacking plants? What innovations could have spared Sandy the horrible choice between COVID and his feet? Innovation can sadly perpetuate inequity. Rapid COVID vaccine development exemplified our capacity for creation, but the pandemic also highlighted how various parts of our world were unable to obtain them. This isn't new. Medications for hepatitis C and HIV are often cost prohibitive for much of the developing world to afford. We know of clinical drug trials structured without proper enrollment of certain racial groups. This therefore questions the drug's efficacy and potentially reduces already limited treatment options for racialized communities. As new grads, there is an opportunity to change this narrative. Innovation must be driven with the philosophy of improving equity, not an accidental byproduct of it. We must understand how structural racism, sexism, and classism impact the development and distribution of innovative solutions. We must ensure innovation remains the great equalizer in medicine, not the cause of further health disparities. And we must listen to the voices of those who experience inequity, because they often find their own creative solutions which can be learned and adopted. As we come out of one public health crisis, innovation will help us respond to new emerging challenges. Many of you graduating today will be involved in creating solutions for new problems. Our education has helped us build a foundation to tackle these problems with compassionate leadership, collective strength, and resilience. As we move forward with our careers and witness new advancements, we must prioritize equity with the doctrine to lift the most vulnerable up. We have the responsibility to ensure that Harvard Chan's core values are enshrined within each new innovation, ensuring that health remains a fundamental right for all, that we improve health quality and delivery, and we empower individuals like Sandy to make sound health decisions. To the class of 2022, over the last 2 years, we have lived public health in our day-to-day lives just as much as we have studied it. And as we leave today with diplomas under our arms, I challenge us to intentionally and provocatively drive innovation for equity to create a world we know is possible. Thank you. Congrats to all of you today, and get well, Dean Williams.
Thank you, Dr. Ghosh.